Hello, today's topic is carcinoma and sarcoma. Objectives, definition, location, risk factor, age distribution, prognosis, and summary. Definition: most cases of cancer involve either a carcinoma or a sarcoma. Now, carcinoma. Carcinoma are cancer that develops in epithelial cells which cover the internal organ and outer surface of your body. Sarcoma. Sarcoma are cancers that develop in mesenchymal cells which make up both your bones and soft tissue, such as muscles, tendons, and blood vessels. What part of the body do they affect? The main difference between carcinoma and sarcoma is where they originate. Carcinomas. Carcinomas, which originated in epithelial cells, tend to affect your skin and mucous membrane. Adenocarcinoma. This type of carcinoma affects organs that produce fluid or mucus, such as the breast or prostate adenocarcinoma. Second, basal cell carcinomas. This type affects the cells that form the foundation of your outermost layer of skin. This is most common type of skin cancer. Squamous cell carcinoma. This type affects the cells above the basal cells in your skin and is the second most common type of skin cancer. Transitional cell carcinoma. This type affects transitional cell in your urinary tract including your bladder, kidney and ureter. These are the four types of carcinoma. Sarcoma. Sarcoma are tumors that develop from the soft tissue cells called mesenchymal cells. Mesenchymal cells help uh, form and support many vital organs and tissue. There are over 75 types of sarcoma. They can occur anywhere but are most common in abdomen, arm or legs. The most common type of sarcoma include first, undifferentiated pleomorphic sarcoma. This type of sarcoma involves soft tissue and bone cells at the same time. Leiomyosarcoma. The type of sarcoma involves smooth muscle cells that line your blood vessels, gastrointestinal tract, and uterus. Osteosarcoma. This type of sarcoma involves bone cells. And fourth, liposarcoma. This type of sarcoma involves fat cells. How common are they? Carcinomas. About 90% of all cancer cases involve a type of carcinoma. Carcinomas affect people of all ages, genders, and ethnicities. There are different risk factors for different carcinoma. Some of these risk factors include smoking, excessive alcohol consumption, long term exposure to ultraviolet light from the sun or tanning beds, long term exposure to heavily polluted air, obesity, inactivity, or lack of physical fitness, being a fair skinned. Sarcoma. According to Cancer Research UK, sarcoma account for less than 1% of cancers diagnosed each year. Like carcinomas, sarcomas can affect anyone. However, certain medical conditions, environmental influences, and lifestyle habit can increase your risk of developing a type of sarcoma. Medical risk factors for sarcoma include tubular sclerosis, retinoblastoma, neurofibromatosis type 1, familial adenomatous polyposis, nevoid basal cell carcinoma syndrome, Werner syndrome, life from many syndrome. Environmental and lifestyle risk factors for sarcoma include exposure to harmful or toxic chemical, especially arsenic, thorium dioxide, and vinyl chloride. Exposure to radiation during cancer therapy. Exposure to repeated radiation from continual or frequent diagnostic imaging scan like X-ray. Type of sarcomas that are more common in infant, children, and young adults include rhabdomyosarcoma, osteosarcoma, alveolar soft part sarcoma, desmoplastic small round cell tumor, epithelioid sarcoma, synovial sarcoma, infantile fibrosarcoma. Types of sarcoma that are more common in adults include adult fibrosarcoma, fibromyxoid sarcoma low grade, liposarcoma, myxofibrosarcomas low grade. Which one is more dangerous? It's a very hard to say whether carcinoma or sarcoma are more dangerous. Survival rates for any type of cancer depend on the variety of factors, including size of the tumor, location of the tumor, growth rate of the tumor or cancerous cell, whether the cancer has spread to other tissue or organ, how many times the cancer has returned after treatment, overall health, age, additional medical conditions like diabetes, BP, gender, ethnicities. Now, summary of difference between sarcoma and carcinoma. Cell type of origin in sarcoma is mesenchymal cells and in carcinoma epithelial cells. Tissue type connective tissue in sarcoma and most of all organ involved in carcinoma. Subtypes over 50 in sarcoma and 4 in carcinoma. Common types in children rhabdomyosarcoma and Ewing's tumor. Adult in adult liposarcoma, leiomyosarcoma, undifferentiated pleomorphic sarcoma, and in carcinoma lung cancer, breast cancer, colon cancer, prostate cancer. Microscopic appearance in sarcoma, cells arranged individually, and in carcinoma, cells arranged in group. Genomic testing, DNA and RNA testing in sarcoma, and only DNA testing in carcinoma. Staging, size and tumor grade most important in sarcoma. Size and lymph node metastasis is most important in carcinoma. Behavior grows as a ball, often rapidly push nearby structure out of the way in sarcoma. Grow via finger-like projection, often slower, invade nearby structures such as nerves and blood vessels in carcinoma. Vascularity more in sarcoma, less in carcinoma. Risk factor often unknown, medical radiation, genetic syndrome, and some exposure in sarcoma. In carcinoma, lifestyle factors like smoking, diet, exercise, radiation, environmental exposure, genetics, precancerous phase present in not present in sarcoma but present in carcinoma. Spread in sarcoma spread via the bloodstream and lung is the most common organ for metastasis. In carcinoma spread via the lymphatic systems and bloodstream. Prognosis and survival depend on the many factors in carcinoma and sarcoma. Thank you.